Well, if you've contracted COVID-19, dealing with the stress of that is already a lot. But when you think about the long-term effects, that can compound the stress. And helping people navigate that is Dr. Sarah Viola. She is an intensivist and pulmonologist at Baltimore, Washington Medical Center. Thank you so much for being with us.
It's an honor. Thank you.
Thank you. So tell me, you are the physician lead for the hospital's COVID-19 recovery program. Tell us what that's all about.
Yeah, so I think there may be a misconception out there that after you survive COVID-19, that you may immediately bounce back and get back to your normal life right after. And certainly there's a lot of talk about the long hauler syndrome, which can even occur when you don't need hospital care. But what we find is that patients who get sick enough to require intensive care in the ICU, they often have a lot of long-term health issues that need to be managed even after they've survived their illness in order to get back on their feet and hopefully back to what they do in their communities and their work lives and family lives.
And so why is a program like this so important? Is it that there wasn't one like this, or this sort of seems like it's like one place where they can sort of handle their emotional and physical needs as well?
Yeah, that's exactly right. My goal with this service is to identify all of the health issues, including mental health issues, physical ailments that they may have, long-term complications for their lung health, and identifying it as the first step. Since COVID-19 is such a new illness, we're still learning exactly what the manifestations are and how to best help these patients. But my goal is to help them navigate these new issues that they have and address those, whether it's referrals to mental health services or just managing their new lung health issues and other physical problems that they may have after critical illness.
And who is eligible to participate?
Primarily, the clinic is designed to address these health issues in patients who have survived an ICU stay. So that's typically patients who, due to COVID-19, required a ventilator or very high amounts of respiratory support, for example, with high flow oxygen. Of course, I'm trying to accommodate as many patients as I can who may have long-term effects of COVID-19, but what we found is the greatest need right now is for patients who have been through the worst of it, who really needed intensive care.
And then what happens during a typical patient appointment?
Yeah, for each initial visit, patients will visit with our medical assistant to go over any medication changes that they had. If any of those are complicated or if the patient has any misunderstandings about that, they can also visit with our pharmacist. In addition to that, every patient gets a basic lung function test called a spirometry test. And that's to get a baseline understanding of whether they have any lung function problems at that point in their recovery from COVID-19. That also allows me to follow over time whether their lung health is declining further, staying the same, or improving as they recover. We'll also help them with any other issues they may have that are lingering from their hospital stay. So sometimes that involves re-engaging them with a physical therapist or an occupational therapist. Sometimes patients still have a tracheostomy tube in place, which they're breathing from through their neck. If that's the case, I'm offering them some support with that and addressing any issues that may still be going on with their tracheostomy tubes. So we try to globally address all of the issues that they may have that are new health problems related to their COVID-19 illness that they're still working on recovering from.
Dr. Viola, so much important information and so much important work that you are doing. I know that people can check out the website. They should just go to umms.org/BWMC to do that. Thank you so much for being with us. Really appreciate it. And we'll be right back with more Midday Maryland right after this. Stay tuned.
Thank you.